If you've sprained the same ankle more than once, your doctor probably told you to rest it, ice it, and do some strengthening exercises. That advice sounds reasonable, but for a specific group of ankle sprain patients, it is making things measurably worse every single time they follow it. I'm about to show you the 5 signs that tell you your ankle sprain isn't a sprain anymore and exactly what to do about it before the damage becomes permanent. You've rolled your ankle, it swelled up, you stayed off of it, it got better, then you rolled it again. Same ankle, same spot, maybe even less force this time, and it keeps happening. You've been told your ankle is weak and that you need to strengthen it. That is just something you're prone to. So you do the exercises, you wear the brace, and you wait for the next one. Meanwhile, the ankle that used to feel solid feels like it could give out on you with any step. After 25 years treating foot and ankle conditions and publishing research specifically on complex ankle ligament injuries, I can tell you that the pattern you're living with has a name, a cause, and a fix. And most patients never get told any of that. I'm going to walk you through the 5 warning signs that separate a normal ankle sprain from a structural ligament damage, what that damage means for your long-term ankle health, and what the right interventions look like before the window to fix cleanly closes. Repeated ankle sprains are not a strength problem, they are a structural problem. Every physical therapist, every urgent care doctor, every online resource says the same thing after an ankle sprain. Rest, ice, compression, elevation, RICE. Then strengthen the muscles around the ankle, the calf raises, resistance bands exercises, and balance work. The logic is that a stronger ankle is a more stable ankle. More patients follow this protocol faithfully because it came from a professional and it makes intuitive sense. Strengthening the muscles around the ankle is not bad advice for a first-time sprain where the ligament is stretched but not torn. The problem is that this advice gets applied identically for every ankle sprain regardless of what actually happened to the ligament. And for a significant number of repeated sprain patients, the ligament isn't just stretched, it's torn. And a torn ligament does not respond to strengthening exercises the way a stretched one does. The ligament's job is to hold the ankle joint in the correct position. When it tears, it doesn't rebuild the way muscle does. Strengthening the muscles around an unstable joint is like tightening the ropes on a tent with a broken pole. The rope tension doesn't fix the pole. You can't strengthen your way out of a torn ligament. When an ankle keeps spraining, the first question isn't how to strengthen it, it's whether the ligament is still structurally intact. I have published research specifically on what I call lateral ankle triad, a pattern where ankle instability, damage to the surrounding tendons, and joint inflammation all occur together and get missed because the practitioner is only looking for a sprain. Patients who come in having done months of physical therapy for what they were told was a weak ankle frequently have ligament damage that no amount of exercise was ever going to fix. When the structural problem is identified and treated correctly, the cycle of repeated sprains stops, not because the ankle muscles got stronger, but because the thing that was failing was finally repaired. So how do you know whether your ankle is in the strengthening category or a structural damage category? That's exactly what the 5 warning signs are designed to tell you. The longer structural ligament damage goes untreated, the harder it becomes to fix. Most patients assume that an ankle problem that isn't getting worse on its own isn't urgent. It's uncomfortable, it's limiting, but it's not an emergency. The common advice is to manage it, brace it, be careful. They say to only consider something more serious if it becomes unbearable. But every time a structurally unstable ankle gives way, every sprain, every roll, every near miss, the ligament sustains additional damage. The joint moves in ways it wasn't designed to move. Over time, the abnormal movement breaks down the cartilage. What started as a ligament problem becomes a joint problem that is significantly harder to fix. So every time your ankle gives out, you are moving closer to a surgery you could have avoided. Ankle instability is not a condition to manage around. It's a condition to fix. And the earlier it gets fixed, the simpler the fix is. Ankle arthritis and ankle replacement surgery are among my core specialties because I see the end stage of exactly this pattern regularly. Patients who come in needing ankle replacement surgery almost always have a history of untreated untreated instability that was managed for years rather than repaired. The instability was the beginning of the chain. The arthritis was the end of it. The gap between those 2 points was filled with time that didn't have to pass the way it did. Catching and treating ligament damage early means a simpler procedure, a faster recovery, and an ankle that functions correctly for decades rather than one that progressively deteriorates towards a much larger intervention. So here are the 5 specific signs that tell you that your ankle has crossed from a sprain into a structural damage territory, and if you recognize yourself in any of them, the time to act is now. If this is resonating and you've been dealing with an ankle that keeps giving way, subscribe so you don't miss the follow-up videos. I'm covering the full range of ankle instability treatment options, from the most conservative to surgical repair, and exactly how to know which one applies to your situation. The 5 warning signs that tell you this is structural damage, not a sprain. There's a specific set of signs that separate a normal sprain that will heal with time from structural ligament damage that will not. Most patients have never been told what those signs are. Here they are. Have you sprained the same ankle 2 or more times? A single sprain can be a normal injury. 2 or more sprains to the same ankle in the same spot is a pattern that points to structural instability, not bad luck. Does your ankle feel like it could give out on you when you're not doing anything athletic? Walking on flat ground, going downstairs, standing on uneven surfaces? A structurally intact ankle feels solid under normal load. An ankle that feels like it might go out at any moment under ordinary conditions has a ligament that is no longer doing the job. Did the most recent sprain happen with less force than the first one? If earlier sprains required a significant misstep and later ones happen on flat ground with minimal provocation, the ligament is becoming progressively more lax with each injury. Is there a sensation of looseness or wobble in the ankle joint itself, separate from any swelling or pain? Patients with ligament damage often describe this as the ankle feeling sloppy or like there's play in the joint that wasn't there before. If you answered yes to 2 or more of these questions, you're not dealing with a sprain that needs more time. You're dealing with a structural ligament damage that needs to be properly assessed before the next injury moves you further down the damage chain. Knowing you have a structural problem is only useful if you know what to do about it, and the answer is more straightforward than most patients expect. Get the right diagnostic workup before you do another round of physical therapy. Stop treating repeated ankle sprains with the same protocol that failed the last time and get a diagnostic workup that actually looks at the ligament. Physical therapy for a misdiagnosed ligament tear isn't harmless. It keeps the patient active and mobile while the underlying instability continues. Every session of balance work and strengthening on an ankle with a torn ligament is another session of loading a joint that is mechanically compromised. The therapy isn't fixing the problem. It's just something to do between sprains. The patient who comes to me after the longest stretches of failed conservative treatment almost always have the same story. Multiple rounds of physical therapy, multiple braces, multiple cortisone shots for swelling. Nobody looked at the ligament directly. Nobody did the specific stress testing that tells you whether the ligament and the joint is mechanically unstable. The workup that would have identified the problem in the first place was never done because a sprain was assumed and the sprain protocol was applied. By the time they reach me, the ligament damage is more extensive and the associated joint damage has had more time to develop. Stop agreeing to another round of the same physical therapy protocol if the ankle has already failed to stabilize after a genuine trial of conservative treatment. Ask specifically for stress x-rays and an MRI of the ankle ligaments. Stress x-rays show whether the joint is mechanically stable under load. An MRI shows the actual condition of the ligament tissue. Those 2 pieces of imaging together give a clear picture of what is actually happening structurally. And that picture is what every treatment decision should be based on. And while you're getting that clarity, there's one thing you can do starting today that reduces the risk of the next sprain while you figure out what the right long-term fix is. Protect the ankle from the next sprain while you get the right assessment. The most dangerous period for a structurally unstable ankle is the window between recognizing the problem and getting it properly treated. The ligament is already compromised. Another significant sprain during that window adds more damage to a structure that is already struggling. Reducing the mechanical load on the ankle during this period, specifically by changing how you move through uneven terrain and what you wear, directly reduces the chance of another injury before you get the right assessment. Think of a fraying rope that is still holding weight. The rope hasn't snapped, but every additional load puts more stress on the threads that are already damaged. You wouldn't add more weight to that rope while you wait for it to be replaced. You'd reduce the load until the repair happens. Your ankle ligament works the same way. Protect it while you get the right help, and you give yourself the best chance of a clean fix rather than a complicated one. Starting today, do these 4 things to protect the ankle while you pursue the right assessment. Number 1, wear a brace that's a lace-up ankle brace, not a sleeve. A lace-up brace with rigid side stays and a figure 8. Wear the brace anytime you're on uneven terrain, exercising, or in a situation where a misstep is possible. A lace-up brace provides the mechanical support the damaged ligament is no longer providing on its own. Avoid barefoot walking on uneven surfaces, including grass, gravel, and sand, until the ligament has been assessed. These surfaces create the unpredictable load angles that exploit ligament laxity. When going downstairs, lead with your stronger ankle and take 1 step at a time rather than alternating. Descending stairs is one of the highest risk movements on an unstable ankle. Book an appointment with a foot and ankle specialist, not a general orthopedist, a foot and ankle specialist, and ask specifically for stress x-rays and ligament MRI. Bring that request in writing so the conversation starts in the right place. A sprained ankle is one of the most common injuries there is. Most of them heal completely and cause no long-term problems. But the ones that keep coming back are telling you something specific, that the structure holding the joint together is no longer intact. And that message deserves a real answer, not another brace and another round of exercises. The fix exists. It's straightforward when it's caught early. If you enjoy this, make sure you watch the next video, which is on your screen now.